I don't like to put temporary material on top of bone graft material that's actually going to be there for a while, providing the scaffolding. It's more of a barrier than anything to protect that bone graft material, because sometimes I actually use Nova bone or some other particulate bone in there, and I don't want to put my temporary right on top of that bone. So I put that little hemostatic barrier there. That hemostatic barrier will dissolve over time, but you start to get the closure of the extraction socket underneath everything. And so by the time it dissolves, your bone graft is, securely in there and protected from the environment. There's a couple of them that I use sometimes. That one is called BioViva, and it's a hemostatic dressing that dissolves over 7 to 10 days. It helps stop bleeding. It acts as a barrier, and it's going to dissolve and leaving your bone graft. It gives time for some closure of the wound over the extraction site, and then but while it's there, it protects your temporary materials from actually touching the bone graft material. Normally we use a membrane, and we try to sometimes get primary closure if we can, but I just put that in there because unless I'm going to actually release a flap, which I don't like to do because I don't want to disturb that blood supply around that tooth. So unless I'm going to release it to try to get primary closure, an extraction socket is always going to leave you a bit of an opening. So I put that osteogen around the implant, and then I put the BioViva on top of that to act as a barrier and as a hemostatic dressing as well.